Hello and welcome to our video about the 21 weeks of pregnancy symptom and baby development, the changes that are happening in your baby's development, and what you can expect during this stage of your pregnancy. Firstly, let's talk about your baby's development. At 21 weeks, your baby is about the size of a carrot, weighing around 360 grams and measuring around 26.7 centimeters long from head to heel. During this stage of development, your baby's body is growing rapidly, and they are developing more defined features. Their eyelids and eyebrows are forming, and their fingernails and toenails are growing. Your baby's brain is also growing rapidly during this stage of development. They are developing more neural connections, which will continue to develop after birth. Your baby is also starting to develop their senses, such as taste, touch, and hearing. They can now hear sounds from outside the womb, so it's a good idea to start talking and singing to your baby to help them recognize your voice. Now let's talk about the symptoms you may experience during this stage of your pregnancy. Firstly, you may start to notice that your belly is getting bigger. As your baby grows, your uterus will expand to accommodate their growth. This can cause some discomfort and may make it more difficult to find a comfortable sleeping position. You may also start to experience some back pain, as the weight of your growing baby can put pressure on your back muscles. To help alleviate this, you can try doing some prenatal exercises that focus on strengthening your back muscles. You can also try using a pregnancy pillow to support your back while you sleep. Another symptom you may experience is heartburn. As your baby grows, they can push your stomach upwards, causing stomach acid to leak into your esophagus. This can cause a burning sensation in your chest and throat. To help alleviate this, try eating smaller, more frequent meals throughout the day, and avoid spicy or greasy foods. You may also notice that your skin is changing during this stage of your pregnancy. Your skin may become more sensitive, and you may develop stretch marks as your belly expands. To help prevent stretch marks, try using a moisturizing lotion on your belly and other areas of your body that may be prone to stretching. Finally, you may start to feel your baby moving more during this stage of your pregnancy. This is a great sign that your baby is healthy and growing. You may feel kicks, punches, or rolls, which can be a fun and exciting experience. As your baby grows, their movements will become more frequent and stronger. In conclusion, at 21 weeks, your baby is growing rapidly and developing more defined features. You may experience some discomfort, such as back pain and heartburn, as your body adjusts to your growing baby. However, feeling your baby move is a wonderful and exciting experience, and a sign that they are healthy and growing. Thank you for watching our video about the 21 weeks of pregnancy symptom and baby development. Please subscribe to our channel for more helpful videos about pregnancy and parenting.
Hello everyone, welcome back to our pregnancy journey. Today, we're going to talk about week 22 of pregnancy, including the symptoms you might be experiencing, as well as the exciting developments happening with your baby. Symptoms. At week 22, you might be feeling some new and different symptoms compared to the previous weeks. Here are some common symptoms you may experience. Braxton Hicks contractions. These are mild contractions that may start to occur in the second trimester. These contractions help prepare your uterus for labor and delivery. Backaches. As your baby grows, your center of gravity shifts, which can cause strain on your back muscles. Be sure to practice good posture and stretch regularly to help alleviate back pain. Leg cramps. You may experience painful leg cramps due to the additional weight you're carrying. Stretching and gentle exercise can help prevent these cramps. Swollen feet and ankles. Your body is retaining more fluids during pregnancy, which can cause swelling in your feet and ankles. Try to elevate your feet when possible and wear comfortable shoes. Baby development. Now, let's talk about the exciting developments happening with your baby at week 22. Your baby is now about 11 inches long and weighs around 1 pound. They are roughly the size of a papaya. Your baby's taste buds are developing, and they can now taste the amniotic fluid. This is the fluid that surrounds your baby in the womb and provides them with nourishment. Your baby's brain is growing rapidly, and they are developing more advanced neurological connections. This means that they can now respond to sound and light, and they may even start to recognize your voice. Your baby's digestive system is starting to function, and they are practicing swallowing amniotic fluid. This helps them prepare for feeding after birth. Your baby's eyes are now fully formed, and they can blink and move them around. They are also developing more pigment in their eyes, which will determine their eye color. Conclusion: so, there you have it, week 22 of pregnancy. As your pregnancy progresses, be sure to take care of yourself and your growing baby. Attend your prenatal appointments, eat a healthy and balanced diet, and stay active with exercise that is safe for pregnancy. And most importantly, enjoy this special time in your life as you prepare to welcome your little one into the world. Thank you for watching, and we'll see you next time. Hello and welcome back to our pregnancy series. In this video, we will be discussing the 23rd week of pregnancy, including the symptoms you may experience and the development of your growing baby. Symptoms: at 23 weeks pregnant, you may start to experience some new symptoms. One common symptom is increased fatigue. Your body is working hard to support your growing baby, which can leave you feeling more tired than usual. It's important to listen to your body and get plenty of rest during this time. You may also experience some discomfort as your uterus continues to expand. This can lead to back pain, pelvic pain, and even leg cramps. Gentle stretches and prenatal yoga can help alleviate these symptoms. Some women may also notice an increase in vaginal discharge at this stage of pregnancy. As long as it's not accompanied by itching or a foul odor, this is typically normal. Baby development. Now, let's talk about your baby's development at 23 weeks. Your baby is now about the size of a large mango, measuring around 11 inches from head to toe and weighing around 1.1 pounds. Your baby's hearing is developing rapidly at this stage, and they can now hear sounds from outside the womb. This means that your baby can hear your voice, so it's a great time to start talking or singing to your growing little one. Your baby's skin is also starting to thicken and become more opaque, although they still have a long way to go before they develop the protective layer of fat that will keep them warm after birth. Your baby's lungs are continuing to mature, and they may start practicing breathing movements by inhaling and exhaling small amounts of amniotic fluid. Finally, your baby's sense of movement and position in the womb is improving. You may start to feel more distinct kicks, punches, and even somersaults as your baby becomes more active. Conclusion: so there you have it, the 23rd week of pregnancy. Remember to take care of yourself and listen to your body's needs, and don't forget to talk to your baby and enjoy the special bond that's forming between you. We hope you found this video informative and helpful. Please subscribe to our channel for more pregnancy updates, and we'll see you in the next one.
Hello and welcome to this week's pregnancy update. If you're 24 weeks pregnant, congratulations, you've made it to the 6-month mark. Let's take a look at what you and your baby can expect during this exciting time. Symptoms: as you near the end of your second trimester, you may start to experience some new or intensified symptoms. Here are a few common ones. Braxton Hicks contractions. You may start to feel mild, painless contractions that come and go. These are a normal part of pregnancy and help prepare your body for labor. Shortness of breath. Your growing baby is taking up more space in your uterus, which can put pressure on your lungs and make it harder to breathe. Heartburn. The hormones in your body that relax your muscles to prepare for childbirth can also relax the valve that separates your esophagus from your stomach, leading to heartburn. Trouble sleeping. As your belly grows, it can be harder to get comfortable at night. You may also be experiencing vivid dreams or nightmares. Baby development. Your baby is growing and developing rapidly during week 24 of pregnancy. Here are some of the exciting things happening. Size. your baby is now about the size of an ear of corn, measuring around 11.8 inches long and weighing about 1.3 pounds. Brain development. Your baby's brain is growing quickly and developing more complex neural connections. Lung development. Your baby's lungs are producing surfactant, a substance that helps the lungs expand and contract properly. Sensory development. Your baby's senses are becoming more refined, and they can now hear your voice and other sounds outside the womb. Movement. Your baby is becoming more active and may be able to kick, twist, and turn in the womb. Tips for the week. Stay hydrated. Drinking plenty of water can help reduce swelling and keep you feeling energized. Sleep on your left side. Sleeping on your left side can improve blood flow to the placenta and help your baby get the nutrients they need. Take breaks. If you're feeling tired or overwhelmed, don't hesitate to take a break and rest. Practice relaxation techniques. Relaxation techniques like deep breathing, meditation, or prenatal yoga can help reduce stress and promote relaxation. Start thinking about childbirth classes. Many hospitals and birthing centers offer childbirth classes that can help prepare you for labor and delivery. That's all for this week's update. If you have any questions or concerns, be sure to talk to your healthcare provider. We'll see you next week for another exciting update on your pregnancy journey. Hello and welcome to this week's pregnancy update. Today, we'll be talking about week 25 of your pregnancy, including the symptoms you may be experiencing and how your baby is developing. First, let's talk about your baby's development. At 25 weeks, your baby is now the size of a rutabaga, measuring around 13.6 inches long and weighing around 1.5 pounds. Your baby's skin is becoming more opaque and less transparent, and the blood vessels are now visible through their skin. Your baby's lungs are also continuing to develop, with air sacs starting to form. This is an important step towards being able to breathe on their own after birth. Your baby is also starting to develop their sense of touch, as the nerve endings in their skin become more sensitive. Now, let's move on to the symptoms you may be experiencing at 25 weeks. Many women find that they have more energy during this time, as their body has adjusted to the changes of pregnancy. However, you may still be experiencing some of the following symptoms. Braxton Hicks contractions. You may start to experience these practice contractions, which are your body's way of preparing for labor. Back pain. As your baby grows, your center of gravity shifts, which can cause back pain. Shortness of breath. As your uterus expands, it can put pressure on your diaphragm, making it harder to breathe. Heartburn. As your baby grows, they can put pressure on your stomach, causing acid reflux. Swelling. Your body may start to retain more water, which can cause swelling in your feet and ankles. Varicose veins. The increased pressure on your blood vessels can cause varicose veins to develop in your legs. Troubles becomes more active. You may find it harder to get comfortable and fall asleep. It's important to remember that every woman's pregnancy is different, and you may experience some, all, or none of these symptoms. If you're concerned about any symptoms you're experiencing, be sure to talk to your health. That's all for this week's pregnancy update. Join us next time for week 26, as we continue to track your baby's development and your pregnancy journey. Thanks for watching.
Welcome to The Incredible Journey, a comprehensive guide to 26-week pregnancy and baby development. Pregnancy is an incredible journey filled with joy, excitement, and sometimes, uncertainty. At 26 weeks pregnant, your baby is about the size of a butternut squash and is rapidly developing. In this video, we'll explore what's happening during the 26th week of pregnancy and take a closer look at your baby's physical and cognitive development. So, sit back, relax, and let's dive in. The 26th week of pregnancy is an exciting time as your baby continues to grow and develop rapidly. This week, your baby is about 14 inches long and weighs around 1.5 pounds. Your baby's senses are developing, and they are becoming more active. In this video, we will explore what's happening during the 26th week of pregnancy and take a closer look at your baby's physical and cognitive development. At 26 weeks pregnant, your baby is rapidly developing, and their senses are starting to come alive. Your baby's brain is developing rapidly, and they are becoming more aware of their surroundings. They can now hear your voice and respond to sounds, and their eyes are starting to open. Your baby is also starting to develop more fat, which will help regulate their body temperature after birth. Your body is also going through many changes during the 26th week of pregnancy. Your uterus is now about 2.5 inches above your belly button, and you may be starting to experience more Braxton Hicks contractions. These are mild, irregular contractions that prepare your body for labor. As your baby grows and your uterus expands, you may experience more aches and pains. Backaches, leg cramps, and hip pain are common at this stage of pregnancy. It's important to rest and take care of yourself during this time. That's it for this video on the 26th week of pregnancy and baby development. We hope you found this information valuable and informative. Remember, every pregnancy is different, so be sure to talk to your doctor if you have any concerns or questions. Join us next time on The Incredible Journey as we continue to explore the miracle of pregnancy and baby development.
Hello everyone, and welcome to this week's video about pregnancy symptoms and baby development at 27 weeks. At this point in your pregnancy, you're already well into your second trimester, and your baby is continuing to grow and develop at an incredible pace. Let's start by talking about some of the common pregnancy symptoms you may be experiencing at 27 weeks. One of the most noticeable changes may be the size and shape of your belly, which is likely to be much larger now than it was just a few weeks ago. You may also be experiencing some swelling in your feet and ankles, as well as back pain and discomfort as your baby continues to put pressure on your spine and pelvic area. Other common symptoms at this stage of pregnancy can include indigestion, heartburn, and constipation, as well as increased fatigue and difficulty sleeping. It's important to continue to take care of yourself during this time by eating a healthy diet, staying hydrated, and getting plenty of rest whenever possible. Now, let's talk about your baby's development at 27 weeks. At this stage, your baby is approximately 14.8 inches long and weighs around 2 pounds. Their eyes are now fully formed, and they are able to blink and open and close their eyes. They are also developing their sense of hearing and may be able to recognize your voice and other familiar sounds. Your baby's lungs are continuing to develop, and they may even be practicing breathing movements in preparation for their arrival into the world. They are also beginning to store up fat, which will help to keep them warm after they are born. Another important development at this stage is the development of your baby's brain. As your baby's brain continues to grow and develop, they may begin to exhibit more complex behaviors and movements, such as grabbing onto the umbilical cord or sucking their thumb. As your due date approaches, it's important to begin thinking about your birth plan and discussing your options with your healthcare provider. This may include deciding on whether or not to use pain medication during labor, as well as considering different birthing positions and other options that can help you to have a safe and comfortable delivery. In addition to preparing for your delivery, it's also a good idea to begin thinking about your postpartum care and support. This may include arranging for help with childcare and household tasks, as well as seeking out resources for emotional support and counseling. As always, if you have any questions or concerns about your pregnancy, it's important to talk to your healthcare provider for advice and guidance. So that's it for this week's video on pregnancy symptoms and baby development at 27 weeks. Thanks for tuning in, and we'll see you in next video. Hello everyone, and welcome back to our pregnancy journey. Today, we are at the 28-week mark, which means we are officially in the third trimester. In this video, we will discuss the symptoms you may experience at this stage of pregnancy and how your baby is developing. First, let's talk about some common symptoms you may experience during the 28th week of pregnancy. At this point, your baby is growing rapidly, which can put a lot of strain on your body. You may feel more tired than usual, and you may also experience shortness of breath as your growing baby puts pressure on your lungs. You may also experience swelling in your hands, feet, and ankles as your body retains more fluid. This is normal, but if you notice severe swelling, be sure to speak with your healthcare provider as it can be a sign of preeclampsia, a serious pregnancy complication. Heartburn and indigestion are also common during the third trimester as your growing uterus puts pressure on your stomach, leading to acid reflux. Eating small, frequent meals and avoiding spicy or acidic foods can help alleviate these symptoms. Now let's talk about your baby's development at 28 weeks. At this stage, your baby weighs around 2.5 pounds and is approximately 15 inches long. Their brain is developing rapidly, and they can now blink their eyes, which have formed fully. Your baby's lungs are also developing, and although they are not yet fully functional, they are producing surfactant, a substance that helps the lungs expand and contract. This is an important milestone in your baby's development as it prepares them for life outside the womb. Your baby's senses are also developing at this stage, and they can now hear your voice and your heartbeat. You may notice that your baby becomes more active when you talk or sing to them. As your baby continues to grow, they will start to gain more fat, which will help regulate their body temperature after birth. They will also continue to practice breathing, and by the end of the third trimester, they will be able to hiccup. So, what can you expect during the rest of the third trimester? As your due date approaches, you may experience more intense Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. You may also notice an increase in vaginal discharge, which is normal but should not have a strong odor or be accompanied by itching or burning. It is also important to start preparing for labor and delivery. Talk with your healthcare provider about your birth plan and attend childbirth education classes to learn about the different stages of labor and coping techniques for pain. In summary, at 28 weeks pregnant, you may experience symptoms such as fatigue, shortness of breath, and swelling. Your baby is rapidly growing and developing, and they can now hear your voice and blink their eyes. As you move into the third trimester, be sure to continue monitoring your symptoms and preparing for labor and delivery. That's all for today's video. Thank you for watching, and be sure to subscribe to our channel for more pregnancy updates.
Hello, and welcome back to our pregnancy journey. Today we're going to talk about the 29th week of pregnancy and what you can expect for both your baby's development and your own body changes. Let's start with your baby. At this point, your little one is roughly the size of a butternut squash, weighing in at around 2.5 pounds and measuring about 15 inches long from head to toe. Your baby's brain is continuing to develop rapidly, and their lungs are starting to produce surfactant, a substance that helps them breathe on their own outside of the womb. Your baby's movements are becoming more pronounced, and you may start to notice a pattern of when they are most active. They are also starting to develop their sense of taste and can taste the amniotic fluid they swallow. Now, let's talk about your body changes. At 29 weeks pregnant, you may notice that your belly is getting bigger, and you're feeling more and more pregnant every day. As your uterus continues to expand, you may experience some discomfort or even pain in your lower back, hips, or pelvis. This is normal, but if you're concerned, talk to your healthcare provider. You may also notice some new symptoms, such as Braxton Hicks contractions. These are practice contractions that feel like your uterus is tightening and releasing. They're usually painless and irregular, but if you're experiencing them frequently or with any pain or discomfort, it's important to let your healthcare provider know. Other common symptoms at this stage of pregnancy include shortness of breath, heartburn, and difficulty sleeping. If you're having trouble sleeping, try sleeping on your left side with a pillow between your knees to support your lower back and hips. It's also important to keep up with your prenatal appointments and any recommended tests or screenings. At your 29-week appointment, your healthcare provider may check your blood pressure, measure your belly, and listen to your baby's heartbeat. As you enter the third trimester of pregnancy, it's important to continue taking care of yourself and your growing baby. This means eating a healthy, balanced diet, staying hydrated, and getting regular exercise. Walking, swimming, and prenatal yoga are great options for staying active during pregnancy. It's also important to prepare for your baby's arrival. Start thinking about your birth plan and what kind of experience you want. Consider taking a childbirth education class, which can help you feel more prepared and confident about labor and delivery. In addition to preparing for the birth, you'll want to start thinking about what you'll need for your baby's arrival. This includes things like a car seat, crib, diapers, and clothing. Overall, the 29-week of pregnancy is an exciting time as your baby continues to grow and develop. As always, if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Thank you for tuning in, and we'll see you next time for another update on your pregnancy journey. Hello and welcome to this video about 30 weeks of pregnancy and baby development. This is an exciting time for both the mother and baby as there are many changes happening. In this video, we will discuss the baby's development, the mother's physical changes, and how to take care of yourself during this period. Baby development. At 30 weeks of pregnancy, the baby is about the size of a cucumber and weighs around 3 pounds. Here are some key developments happening at this stage. Brain development. The baby's brain is growing rapidly, and the cerebral cortex is developing, which is responsible for controlling movement, sensation, and perception. Lung development. The lungs are almost fully developed, and the baby is practicing breathing movements, which will help them breathe on their own after birth. Fat deposits. The baby is accumulating fat deposits under the skin, which will help regulate their body temperature and provide energy after birth. Sensory development. The baby's senses are becoming more refined, and they can recognize sounds, light, and even taste. Movement. The baby is quite active and can move around, kick, and even hiccup. You may feel their movements quite strongly at this stage. Mother's physical changes. As the baby grows, the mother's body will also go through many changes. Here are some of the most common physical changes at 30 weeks. Weight gain. Most women will have gained around 20 to 25 pounds by this stage of pregnancy. The weight gain is essential for the baby's growth and development. Braxton Hicks contractions. These are mild contractions that may be felt in the uterus. They are not usually painful and are a sign that the uterus is preparing for labor. Stretch marks. The skin around the abdomen may begin to stretch, causing stretch marks. These usually fade after pregnancy. Fatigue. As the baby grows, the mother may feel more tired and require more rest. Shortness of breath. The growing baby can put pressure on the diaphragm, making it harder to breathe deeply. Taking care of yourself. It's essential to take care of yourself during pregnancy to ensure both you and your baby stay healthy. Here are some tips for staying healthy during the 30th week of pregnancy. Eat a healthy diet. Make sure you are eating a balanced diet that includes plenty of fruits, vegetables, and lean protein. Avoid foods that are high in sugar or fat. Stay active. Regular exercise can help you feel better and reduce stress. Walking, swimming, and prenatal yoga are all good options. Conclusion. At 30 weeks of pregnancy, the baby is growing rapidly, and the mother's body is going through many changes. It's essential to take care of yourself and attend regular prenatal checkups to ensure both you and your baby stay healthy. Remember to eat a healthy diet, stay active, get plenty of rest, and drink plenty of water. Thank you for watching, and we wish you a healthy and happy pregnancy.
Welcome back to Healthcare Lover. Today, we're diving into a topic that's close to my heart, eating healthy on a budget. Yep, you heard it right. Eating nutritious meals doesn't have to break the bank. Stick around as we unveil the top 20 points for healthy eating on a budget. Point 1. Plan your meals. Host. First things first, folks. Planning is key. Take a little time each week to plan your meals. It not only helps you stay organized, but also prevents unnecessary trips to the store and those impulse junk food buys. Point 2. Buy in bulk. Now, let's talk about buying in bulk. Purchasing staples like rice, beans, and oats. In bulk not only saves money, but ensures you always have a solid foundation for your meals. Point 3. Seasonal produce. Ah, the beauty of seasonal produce. Opt for fruits and veggies that are in season. They're not only fresher, but also more affordable. Pro tip. Farmers markets are fantastic for scoring some great deals. Point 4. Frozen is your friend, don't shy away from the frozen aisle. Frozen fruits and vegetables are often just as nutritious as fresh ones and have a longer shelf life. Plus, they can be more budget-friendly. Point 5. Meal prep magic. Meal prep is a game changer. Spend a few hours each week preparing your meals in advance. Not only does it save you time, but it also keeps you from opting for those less healthy, on-the-go choices. Point 6. DIY snacks. Snacking doesn't have to be a guilty pleasure. Make your own snacks at home, like trail mix or granola bars. It's not only healthier, but also more cost-effective. Point 7. Store brands rock. Let's talk about loyalty, store loyalty. Don't overlook store brands. They're often just as good as the fancy labels, but come with a friendlier price tag. Point 8. Coupon craze. Coupons, coupons, coupons. Embrace the coupon craze. Keep an eye out for discounts, both online and in-store. They can add up to significant savings over time. Point 9. Buy frozen proteins. Protein can be pricey, but fear not. Frozen proteins like chicken breasts or fish fillets are often more affordable than their fresh counterparts. Stock up when you spot a good deal.
Or IVF, a common treatment option for couples attempting to conceive. First, a basic explanation of how IVF works. The procedure starts with a woman taking medicine to encourage the development of numerous eggs in her ovaries. Once the eggs are ready, they are extracted during a small surgical operation. Next, the eggs are fertilized with the partner's or a donor's sperm in a laboratory dish. The resultant embryos are then transferred to the woman's uterus, with the goal that at least one will implant and result in a healthy pregnancy. IVF is often advised for couples who have been trying to conceive for at least 1 year without success, or for those with a known reproductive condition such as blocked fallopian tubes or low sperm count. It's crucial to understand that IVF is not always successful on the first try, and numerous rounds may be required to obtain a pregnancy. Additionally, IVF may be a physically and emotionally hard procedure, so it's crucial to have support and advice from a fertility professional and counselor. Whether you and your spouse are contemplating IVF, it's crucial to have a comprehensive examination and conversation with a fertility expert to see if it's the best decision for you. Thank you for watching. We hope this summary has been useful in understanding the fundamentals of IVF and the possibilities it has for families dealing with infertility.
Title: Effective PCOS Treatment, 20 Key Steps to Manage Polycystic Ovary Syndrome. 1. Introduction. Greet your viewers and provide a brief overview of PCOS. Mention the importance of early diagnosis and management. 2. Understanding PCOS. Explain what PCOS is and its impact on women's health. Highlight common symptoms such as irregular periods, acne, and weight gain. 3. Seek professional help. Emphasize the importance of consulting a healthcare professional for a proper diagnosis. Encourage viewers to find a healthcare provider experienced in managing PCOS. 4. Lifestyle modifications. Discuss the role of diet and exercise in managing PCOS symptoms. Suggest a balanced diet with emphasis on whole foods and regular physical activity. 5. Weight management. Address the link between PCOS and weight gain. Provide tips on healthy weight loss strategies, if applicable. 6. Medication options. Briefly explain common medications prescribed for PCOS, such as birth control pills and anti-androgens. Highlight the importance of medication adherence. 7. Nutritional supplements. Discuss supplements like inositol and vitamin D that may benefit women with PCOS. Emphasize consulting a healthcare professional before starting any supplement regimen. 8. Fertility considerations. Touch on the challenges PCOS may pose to fertility. Mention fertility treatments and options for those planning to conceive. 9. Hormonal balance. Explain how hormonal imbalances play a role in PCOS. Discuss hormone therapy options prescribed by healthcare professionals. 10. Regular monitoring. Stress the need for regular checkups and monitoring of PCOS symptoms. Encourage open communication with healthcare providers. 11. Stress management. Discuss the impact of stress on PCOS symptoms. Suggest stress reduction techniques such as meditation and yoga. 12. Sleep hygiene. Highlight the importance of adequate sleep for overall health. Discuss the link between PCOS and sleep disturbances. 13. Skincare. Address skin-related concerns associated with PCOS. Provide skincare tips to manage acne and other skin issues. 14. Customized treatment plans. Acknowledge that PCOS treatment is not one size fits all. Encourage viewers to work with their healthcare providers to develop personalized plans. 15. Educational resources. Recommend reliable sources for further PCOS education. Mention reputable websites and support groups. 16. Community support. Emphasize the value of connecting with others who have PCOS. Mention online forums or local support groups. 17. Ongoing education. Encourage viewers to stay informed about new developments in PCOS research. Highlight the importance of staying proactive in managing one's health. 18. Mind-body connection. Discuss the impact of mental health on PCOS. Encourage practices that promote a healthy mind-body connection. 19. Long-term outlook. Discuss the long-term management of PCOS. Address the potential impact on overall health as women age. 20. Conclusion. Summarize key points. Encourage viewers to take a proactive approach to their PCOS management. Remember to tailor the script to your audience and provide accurate, up-to-date information.
Step-by-step guide to in vitro fertilization, IVF. How IVF works. 1. Introduction. Welcome to our step-by-step guide to in vitro fertilization, or IVF, the groundbreaking process that's helped countless families realize their dreams of parenthood. 2. Step 1. Fertility medications. The journey begins with fertility medications, typically administered as shots. These medications stimulate your ovaries to produce multiple mature eggs. The goal? To harvest 10-15 eggs, a process that typically takes about 2 weeks until your eggs are ready for retrieval. 3. Step 2. Egg retrieval. Next up is the egg retrieval process, a brief procedure lasting 15 to 30 minutes. During retrieval, a doctor utilizes ultrasound guidance to insert a thin, hollow tube through your vagina and into the ovary containing the eggs. A suction device connected to a needle gently retrieves the eggs from each follicle. 4. Step 3. Fertilization. Now, it's time for fertilization, a critical stage in the IVF process. In traditional IVF, eggs and sperm are left in a laboratory dish to fertilize naturally. Alternatively, in intracytoplasmic sperm injection, ICSI, a single sperm is directly injected into the egg for fertilization. This method bypasses natural barriers, increasing the likelihood of successful fertilization. 5. Step 4. Embryo development. Once fertilization occurs, the embryo begins to divide its cells, eventually reaching the blastocyst stage, 5-6 days post-fertilization. At this stage, multiple embryos are carefully selected for transfer back into your uterus. 6. Step 5. Embryo transfer. The final step, embryo transfer. Multiple embryos are transferred back into your uterus with the hope that at least one will successfully implant and begin to develop. 7. Conclusion. And there you have it, a comprehensive overview of the IVF process, from fertility medications to embryo transfer. If you're considering IVF or simply curious about the procedure, don't hesitate to reach out to a qualified fertility specialist. Thanks for joining us, and we wish you all the best on your journey to parenthood.
The effects of teenage pregnancy, 20 key points. 1. Introduction. Hello everyone, welcome back to our channel. Today, we're diving into a crucial topic, the effects of teenage pregnancy. 2. Higher health risks. Teenage mothers often face higher health risks during pregnancy compared to older women. 3. Educational challenges. Teen moms are more likely to drop out of school, limiting their educational and career opportunities. 4. Economic impact. Teenage pregnancy can contribute to financial strain on families and communities. 5. Emotional stress. Young parents may experience heightened emotional stress due to the challenges of parenthood at an early age. 6. Impact on mental health. Teenage mothers are at a higher risk of experiencing mental health issues such as depression and anxiety. 7. Social stigma. Teen moms often face social stigma and judgment from peers and the community. 8. Parenting skills. Being a parent requires skills that young individuals might not have fully developed, impacting effective parenting. 9. Relationship strain. Teenage pregnancies can strain relationships, leading to higher rates of breakups. 10. Limited social life. Young parents may find it challenging to maintain an active social life due to parenting responsibilities. 11. Child development. Children born to teenage parents may face developmental challenges. 12. Single parenthood. Teenage pregnancies often lead to single parenthood, which can be challenging for both the parent and child. 13. Healthcare access. Access to proper healthcare may be compromised, affecting both maternal and child health. 14. Generational cycle. Teenage pregnancy can perpetuate a cycle, as children of teen moms may be more likely to become teen parents themselves. 15. Limited career opportunities. Teen moms often face difficulties pursuing and maintaining careers, impacting their financial independence. 16. Child poverty. Children of teenage parents are at a higher risk of living in poverty. 17. Higher rates of preterm births. Teenage pregnancies are associated with higher rates of preterm births, affecting the baby's health. 18. Child abuse. Risk. Teen parents may be at a higher risk of unintentional child abuse due to lack of experience and stress. 19. Impact on educational goals. Teen moms may struggle to achieve their educational goals, limiting their potential in various fields. 20. Prevention and support. It's crucial to focus on prevention and provide support systems to help reduce the impact of teenage pregnancy on individuals and society. Closing. Thanks for joining us today. If you found this video informative, don't forget to like, share, and subscribe. Let's continue the conversation in the comments below. Until next time, stay informed.
11 weeks pregnant, your baby's development. From an oversized head to tiny tooth buds, this week is full of exciting growth and changes, both big and small. Your baby's facial features are slowly maturing, with the ears now moving toward their final position on the sides of the head, and the eyes set wide apart with eyelids fused shut. Genitals are forming too, although it's still too early for your healthcare provider to tell if you're having a girl or a boy. But even though you don't know your baby's gender yet, why not start a list of your favorite baby names for boys and girls? Have some fun with our baby name generator. You still have plenty of time to browse and find a name you love. Tiny buds that will eventually become teeth are developing. The head makes up half the total body length at this stage, although in the coming weeks the body will grow significantly too. To support all this growing, your baby now needs more nutrients, so the placenta grows, and its red blood cells increase in number to meet this need. The size of the fetus at 11 weeks pregnant. At 11 weeks, the fetus is about the size of a Brussels sprout. From crown to rump, the average length is now 2 inches, and the average fetus weighs just about 0.33 ounce. Mom's body at 11 weeks pregnant. Are you having unusual food cravings this week? They're quite common. Between 50 and 90% of women experience these cravings at some point during pregnancy. No one knows for sure why pregnancy cravings occur. Some medical experts believe these cravings are your body's way of telling you what it needs, while others blame them on changing hormone levels. As long as your food choices are part of a healthy pregnancy diet, go ahead and eat up. There is a type of craving that needs medical attention. However, if you crave non-food items like clay or dirt, contact your healthcare provider. 11 weeks pregnant, your symptoms. At 11 weeks pregnant, here are some of the symptoms you may be experiencing. Breast growth. Your breasts may be a little larger now, and you can expect to see even more growth as your pregnancy progresses. Some of this may be because the milk glands grow in preparation for breastfeeding. You might gain up to 3 pounds of breast tissue over the course of your pregnancy. Increased vaginal discharge. Your body may be releasing more clear vaginal discharge now. This is normal as long as it is odorless and clear or white in color. If you notice changes including blood, itchiness, or a foul odor, healthcare provider to rule out. Dark abdominal line. You might notice you have developed a long, dark line that runs vertically down the center of your belly. It's called the linea nigra, or the pregnancy line, and it's thought to be associated with hormonal changes. This line will likely fade after your baby's birth. Leg cramps. You may be troubled by tight, painful leg cramps, particularly at night. This can make it tough to get a good night's rest. Stretching can help with leg cramps, as can exercise. In some cases, mineral depletion may contribute to having leg cramps, so make sure that your diet is giving you enough calcium and magnesium, and take care to stay hydrated. Fatigue. Right now, your levels of the pregnancy hormone progesterone are increasing, which can sometimes make you sleepy when you'd rather be alert. And, if you've been waking to pee or having leg cramps or getting heartburn during the night, your sleep may be suffering too. Eliminating caffeine and following a relaxing bedtime ritual every evening can help fight pregnancy fatigue. Mood swings. You can thank your heightened hormone levels if you've been experiencing mood swings or moodiness lately. Try to avoid stress, and ensure you're getting enough iron in your diet. Practicing yoga, doing simple meditations, or relaxing while listening to soft music might help you feel a little better. You could also ask your healthcare provider for advice on dealing with your mood swings, particularly if they're interfering with your daily life. Morning sickness. You might experience queasiness and even vomiting at 11 weeks pregnant, and this can occur at any time of day. Morning sickness often subsides in the second trimester, though, and you're almost there. Baby development at 12 weeks. Your baby is about the size of a lime. Length: 2.13 inches. Weight: 2.05 ounces. Small movements. This week, your baby can open and close their hands, making a fist, and curl their toes. Tiny fingernails. Your baby has itsy bitsy nails growing on their fingers and toes. Your baby's intestines. The stomach and esophagus started forming around 7 weeks of pregnancy, and your baby's intestines grew so fast that they protruded into the umbilical cord. Soon, the abdominal wall will close and their intestines will make their way inside their abdomen. Your baby, although tiny, is now fully formed. They are about the size of a plum. The placenta is also now fully formed, although it will keep growing throughout your pregnancy. The placenta is your baby's life support system, passing oxygen, nutrients and antibodies from your blood supply to your baby. From now on, your baby is going to grow. Even though you can't feel it yet, your baby is moving, waving and dancing. They can also swallow. Your 12-week fetus is almost done developing their body's important systems and parts, which means it's all about getting bigger and more mature from here on out. Yep, baby's about to enter the growth and maturation stage, in which organs and tissues will grow and develop rapidly. Baby at 12 weeks is opening and closing their fingers and curling their toes, and their brain is developing fast. Baby is now developing reflexes, if weak pregnant belly while looking at baby on an aching stomach, nausea, mood swings, a metallic taste in your mouth, sore breasts, indigestion and heartburn, headaches, dizziness, new likes and dislikes for food and drink, a heightened sense of smell, a white milky pregnancy discharge from your vagina, light spotting, see your doctor if you get bleeding in pregnancy, cramping, a bit like period pains, darkened skin on your face or brown patches, this is known as chloasma or the mask of pregnancy, greasier, spotty skin, thicker and shinier hair, bloating and the feeling of being bloated.
14 weeks pregnant. Your baby's development. Welcome to your second trimester. Your little one is trying out some new moves this week. Your baby's eyes are starting to move, and those little legs and arms are starting to flex. These movements also allow your baby to practice the important skill of moving hands to mouth. The senses of smell and taste are also developing, and your baby's skin is thickening too. You'll have to wait and see if your baby will be born with a full head of hair or not, but right now, hair follicles are forming under the surface of the skin. With each passing week, your baby is looking more and more like the little person you'll meet the day you give birth. By now, or very soon, the genitals are fully developed. But it's still too early to know whether you're having a boy or a girl. How big is my baby at 14 weeks? At 14 weeks, your baby is growing and developing rapidly, measuring between 3.5 and 4 inches long and weighing around 2 ounces, about the size of a navel orange. The size of the fetus at 14 weeks pregnant. At 14 weeks, the fetus is roughly the size of a nectarine. Around this time, the average fetus weighs about 1.5 ounces and can measure up to 3.5 inches long, crown to rump. Making faces. Thanks to brain impulses, your baby's facial muscles are getting a workout. Those tiny features can squint, frown, and grimace. Your baby is also making sucking and chewing movements. Growing hair. Soft baby hair is coming. Hair follicles have started to form deep in your baby's skin. Around 20 weeks, fine downy hair will sprout from these follicles on your baby's eyebrows, upper lip, and chin. Your active baby. Though you can't feel those tiny punches and kicks yet, your baby is quite active and has flexible hands and feet. Mom's body at 14 weeks pregnant. You've finally reached the second trimester. Pregnancy symptoms during week 14. No more morning sickness? Your energy is likely returning, and your queasiness may have eased by now. If not, hang on, chances are good that morning sickness will soon be behind you if it's not already. Although it's uncommon, some expecting moms will still feel nauseated months from now. Tell your healthcare provider at your next appointment if you're still having nausea or vomiting. Starting to show. The top of your uterus is a bit above your pubic bone, which may be enough to push your tummy out a tad. Starting to show can be quite a thrill, giving you and your partner visible evidence of the baby you're waiting for. Bleeding gums. About half of pregnant women have swollen, red, tender gums that bleed when flossed or brushed. This gum inflammation, called pregnancy gingivitis, is partly caused by hormonal changes that make your gums more sensitive to the bacteria in plaque. Be sure to brush your teeth twice daily, and floss daily. Round ligament pain. On either side of your uterus, you have 2 ligaments that stretch and thicken to accommodate your growing belly. These changes may cause round ligament pain. It can feel like a short, stabbing pain in response to movement, or a dull ache after an especially active day. If round ligament pain strikes, try to stop and rest, pay attention to your posture, change positions, gently massage the area, or take a warm bath. Some women find that wearing a maternity belt for extra support helps relieve the pain. Increased appetite. Pregnancy hunger starts and peaks in the second trimester. Your body is working hard to support your baby, and that requires plenty of energy. Your meals are also fueling your body's pregnancy changes, which include a much higher blood volume, your growing breasts and uterus, and increased fat stores. You need an extra 300 to 350 calories per day in the second trimester. Round ligament pain. For some women, a possible side effect of uterine growth is what your OB/GYN would call round ligament pain. Basically, these are pregnancy growing pains that feel like achy or sharp pains on one or both sides of the abdomen. That begin to appear around 14 weeks but can strike at any time during the second trimester. Here's why. The uterus is supported by thick bands of ligaments that run from the groin up the side of the abdomen. As your uterus grows, the supporting ligaments stretch and thin out to accommodate the increasing weight. This weight pulls on the ligaments and causes a sharp pain or a dull ache in your lower abdomen. It's often more noticeable when you change positions suddenly or quickly get up from sitting or lying down, or when you cough or sneeze. The best way to bring relief? Put your feet up and rest in a comfortable position, which should ease the strain and the pain. Baby development at 15 weeks. Your baby is about the size of an apple. Your baby is around the size of an apple or a navel orange, around 4 inches, 10 centimeters, from crown to rump. It weighs approximately 70 grams, which is equivalent to 0.15 pounds. Baby weight at 15 weeks is similar to the weight of one chicken egg. Your baby at week 15. Pregnancy week 15, fetal development. Your baby at 15 weeks pregnant has already formed all its vital organs, so now it's time to grow bigger and stronger. Among the milestones of week 15 of pregnancy fetal development is the beginning of bone ossification. The muscles are strengthening, and the bones are becoming harder. By now, the baby has longer limbs and can move its joints. Although it's not common, some women can feel baby movements at 15 weeks pregnant. Your baby is also practicing how to breathe outside your womb. She is actively drawing in amniotic fluid through her nose. It is getting into the upper respiratory tract, developing the lungs. The baby's skin is still very translucent, and small blood vessels are forming under it. Your 15-week fetus is also practicing other reflexes, such as swallowing and sucking. At 15 weeks of pregnancy, your baby is also looking much cuter, since its head is now proportional to the rest of its body. Their skin is getting covered in very fine hair, which is called lanugo and helps keep the baby warm. In the womb, a 15-week baby is also able to hear your voice. Make sure you talk to your baby constantly. How big is my baby at 15 weeks? Curious why your body is, probably, finally starting to look pregnant? It's because at 15 weeks pregnant, your baby is quickly growing bigger each week. He's as long as 4 inches right now and weighs around 2.5 ounces. Baby is looking more like a baby. With each passing week, your fetus is also looking more and more like the baby you're picturing in your dreams. By now, the ears are positioned properly on the sides of the head, they used to be in the neck, and the eyes are moving from the side of the head to the front of the face, where they'll soon meet your loving gaze. Sense of taste. Your baby is forming taste buds, and nerves begin connecting them to the brain. By about 20 weeks, your baby's taste buds will be fully formed. During pregnancy, molecules of what you eat pass through your bloodstream and make it into your amniotic fluid. But your baby doesn't actually taste what you're eating, so don't worry that they won't enjoy what you're having for dinner. Baby movement. Your baby's legs are growing longer than their arms now, and they can move all of their joints and limbs. Your active baby is moving constantly, though you can't feel it yet. Your baby's face. Your baby is looking more like a little person, with eyelids, eyebrows, eyelashes, nails, hair, and well-defined fingers and toes. If you could see inside your womb, you'd catch your baby sucking a thumb, yawning, stretching, and making faces. What's happening in my body? Your baby is growing quickly and comes with a lot of packaging, the amniotic sac and fluid, and their own food supply, placenta. You could start getting the odd jabbing pain on the sides of your bump. This is known as round ligament pain. Putting your feet up and resting can help. Your skin could also feel a bit itchy. It might help to use an unperfumed moisturizer, wear loose cotton clothing, and have a cool bath. If the itching gets worse, especially at night, talk to your doctor or midwife. 15 weeks pregnant lifestyle. Make sure you're getting enough. Bones are beginning to ossify. Calcium is more important than ever. A prenatal supplement should be able to provide the calcium you need, but you can also increase your dietary intake for an extra boost. Monitor your weight gain. Drastic weight gain can be a sign of preeclampsia. Talk to your doctor if you think you're gaining too many pounds. Keep a healthy diet. You've probably made some healthy dietary changes in the previous weeks, and your 15 weeks pregnant diet should stay healthy. Of weight gain. Stay safe. Although it's advisable to exercise during your pregnancy, 15 weeks pregnancy precautions include avoiding contact sports or sports that carry a risk of falling, like horse riding. Go to the dentist. It might not be pleasant, but taking care of your teeth can actually lead to a healthier pregnancy. Women who develop gingivitis during pregnancy have a higher risk of complications, including preterm birth. Second trimester pregnancy symptoms at 15 weeks. Your pregnancy symptoms may include swollen and bleeding gums, pains on the side of your belly, caused by your expanding womb, known as round ligament pains, headaches, nosebleeds, feeling bloated, indigestion and heartburn, sore breasts, leg cramps, feeling hot, dizziness, swollen hands and feet, urine infections, vaginal infections, darkened skin on your face or brown patches. This is known as cloasma or the mask of pregnancy. Greasier, spotty skin, thicker and shinier hair. You may also experience symptoms from earlier weeks, such as morning sickness, a heightened sense of smell, mood swings, a white milky pregnancy discharge from your vagina and light spotting. Seek medical advice for any bleeding.
The size of the fetus at 16 weeks pregnant. At 16 weeks, your fetus is now the size of an apple. Your little one could be more than 4.5 inches long, crown to rump, and weigh close to 4 ounces. How big is my baby at 16 weeks? Your baby now weighs in at a whopping 3 to 4 ounces, and is 4 to 5 inches in length. The backbone and tiny muscles in your baby's back are gaining strength, so she can straighten out that head and neck even more. Thanks to those developing facial muscles, your baby is capable of making a few expressive frowns and squints, even at this early stage. Baby's beautiful eyes are finally working too, making small side-to-side movements and perceiving light, although the eyelids are still sealed. Delicate baby skin. Your baby's skin is thin and translucent. It will thicken and develop as your pregnancy progresses, but will continue to be almost transparent for quite some time. And here's the skinny on baby skin. It's practically translucent now, so if you took a peek inside your uterus, you'd be able to see your baby's blood vessels under that thin skin. Scalp patterning. On your baby's scalp, hair follicles are forming a pattern that will remain for life. This patterning sets the stage for how your baby's hair will grow. New hair follicles don't form after birth, so babies are born with all the hair follicles they'll ever have. Heart at work. Your baby's heart is now pumping about 25 quarts of blood each day, and this amount will continue to increase as your little one develops. Baby will soon hear your voice. Listen up, tiny bones in your fetus ears are in place, making it likely that baby will soon be able to hear your voice, or something like it, when you're speaking. Generally, babies fully develop the ability to hear in the womb by 18 weeks of pregnancy. During its 16th week of development, a fetus will be starting to form facial expressions, and its nervous system will be growing. Your body at week 16. Rapid growth. At 16 weeks pregnant, your uterus is growing at about the same pace as your baby's. It's getting to the point where you may not be able to hide your pregnancy anymore, even if you wanted to. Your 16 weeks pregnant belly. At 16 weeks pregnant, you may now be at the stage where your bump clearly has a baby in there. Your pregnancy weight gain. It may be hard to watch yourself gain weight during pregnancy, even when you know there's a wonderful reason for it, but try to embrace your body's new shape and think of every pound you put on as a sign of good health for you and your baby. Nasal congestion. 16 weeks pregnant, your symptoms. At 16 weeks pregnant, here are some of the symptoms you may be experiencing. Skin changes. You might have heard about the pregnancy glow, and now it might be your turn to experience it. Increased blood volume in the blood vessels and pregnancy hormones causing more oil production can make pregnant skin look flushed and dewy. Nosebleeds. At 16 weeks pregnant, nosebleeds can be an issue for some moms-to-be, and might be caused by increased circulation and higher levels of hormones. Lower back pain. This is one of the most common symptoms that can strike when you're pregnant, and it's good to have some strategies to avoid or lessen the discomfort. For example, Take warm baths or showers, stretch regularly to help your hardworking back muscles relax, pay attention to your posture, and wear low-heeled shoes. Dizziness. Round ligament pain. As your amazing uterus grows, the round ligaments that support it are thickening and stretching. Breast changes. Pregnancy headaches.
17 weeks baby development. How big is your baby at 17 weeks pregnant? The baby is around 5.1 inches this stage. This is roughly the size of a potato. The skin is loose and wrinkled and the fetus has a lot of growing to do. By the time of the delivery, he or she will fill out their skin more normally. Around this stage of pregnancy, the fetus starts to look a lot more human. In addition to hair growing on the head, the eyebrows and eyelashes are also developing. The eyelids are shut, but the eyes themselves can move and the mouth can also open and close. The fingernails and toenails are growing, and your bundle of joy has also developed a firm grip. Your baby's been getting bigger and bigger over the last couple of weeks, and this means that he or she has needed a larger placenta. Remember that the placenta is the organ that supplies nutrition to the fetus, removes waste products, and fulfills other important roles. By the end of your pregnancy, the placenta will weigh around 510 grams. Your baby now has doubled in weight in the last 2 weeks. Fat begins to form, helping your baby's heat production and metabolism. The lungs are beginning to exhale amniotic fluid, and the circulatory and urinary systems are working. Your baby's bones. Your baby's skeleton is changing from soft cartilage to bone. Support your baby's bone health, and your own, by eating calcium-rich foods. Getting enough calcium also reduces your risk of hypertension and preeclampsia. The umbilical cord. The umbilical cord, your baby's lifeline to the placenta, is growing stronger and thicker. By the end of pregnancy, it will be approximately 9 inches long and an inch thick. The umbilical cord delivers nutrients to your baby and ferries away waste products. Your baby's skin. Sweat glands are starting to develop. And by next week, the layers of your baby's skin will be fully formed. Your baby when you're 17 weeks pregnant. Your baby is getting bigger all the time and might now weigh more than the placenta. Your baby is about 13 centimeters from head to bottom and about 150 grams. Your baby's external sex organs are completely formed. And your baby passes urine Your baby will also swallow some amniotic fluid. This is normal. Loud noises might make your baby startle. Your baby's taste buds are working, and your baby can tell the difference between sweet and bitter. What does my baby look like? Your baby, or fetus, is around 12 centimeters long, from head to bottom, and weighs around 150 grams. That's roughly the size of a pomegranate and the weight of a ball of mozzarella. Your baby can move their eyes, although they'll stay shut for now. React to loud noises, open and close their mouth. Your baby's fingernails are starting to grow and will have their own unique fingerprints. Even identical twins have different fingerprints. Week 17, your second trimester. You might start to feel your baby move now. You will not be able to tell exactly what your baby's up to, but soon you could be feeling every kick, punch, hiccup and somersault. Your baby's movements. Many women spot the first signs of their baby moving between 18 and 24 weeks. Inside your tummy, you might feel bubbling, fluttering, rolling. You might find that your baby moves more after meals, when you listen to loud music, when you rub your tummy and talk to your baby, when you are relaxing. Here are some of the other symptoms you may be experiencing: tiredness and difficulty sleeping, swollen or bleeding gums, pain on the side of your belly, headaches, nosebleeds, bloating or constipation, indigestion. Baby development at 18 weeks pregnancy. At 18 weeks of pregnancy, your baby is developing at an incredible rate. During this stage of pregnancy, the baby's body is becoming more proportional, and the organs are maturing. The baby's bones are solidifying, and the baby is beginning to practice making facial expressions. The baby is now able to move in a more coordinated fashion. The baby is able to stretch, kick, and move its arms and legs. It may even be able to respond to external sounds and pressure, such as music or when you press on your abdomen. The baby's senses are developing at this stage of pregnancy as well. The baby's eyes are beginning to open and can detect light. The ears are also opening and allowing the baby to hear sounds from outside the womb. The baby has also developed taste buds and can now distinguish between sweet and sour flavors. The baby is beginning to produce surfactant, a substance that enables the lungs to expand and contract. This will eventually allow the baby to breathe on its own. The baby's hair, nails, and lanugo, the fine hair that covers the baby's body, are also developing. At 18 weeks, your baby is growing rapidly and developing new skills. Although it may be difficult to imagine, your baby is quickly becoming more and more like a newborn. As your baby continues to grow, you will be able to feel more and more of its movements inside your womb. By the end of this stage of pregnancy, you will be able to feel your baby's kicks, punches, and hiccups. Hello and welcome to our video on 19 weeks of pregnancy symptom and baby development. Congratulations on making it to the halfway point of your pregnancy. This is an exciting time as your baby continues to grow and develop, and you start to feel more and more like a mom-to-be. In this video, we'll cover what's happening with your baby and your body during the 19th week of pregnancy. Let's start with your baby's development. At 19 weeks, your baby is the size of a mango, measuring about 6 inches long and weighing around 8.5 ounces. This week, your baby's skin is getting thicker and more opaque, and you may even be able to see tiny veins underneath. Your baby's ears are also fully formed, and they can now hear your voice and other sounds from outside the womb. Your baby's brain is developing rapidly, and the neurons in their brain are now forming more complex connections. This means that your baby's movements are becoming more start to play with their umbilical cord. Your baby is also starting to develop more defined facial features, including eyebrows and eyelashes. Now, let's talk about the symptoms you may be experiencing at 19 weeks pregnant. By this point, many of the early pregnancy symptoms have subsided, and you may be feeling more like yourself again. However, you may still be experiencing some common symptoms such as Braxton Hicks contractions. You may start to feel mild contractions in your uterus as early as the second trimester. These contractions are completely normal and help to prepare your body for labor. Increased appetite. You may find that you're hungrier than usual, especially as your baby's growth requires more energy. Back pain. As your baby grows and your belly expands, you may start to experience back pain. This is due to the extra weight you're carrying and the changes in your posture. Swollen feet and ankles. You may notice that your feet and ankles are starting to swell, especially if you've been standing or sitting for long periods of time. To reduce swelling, try elevating your feet whenever possible and wearing comfortable shoes. Skin changes. You may notice that your skin is becoming more sensitive or that you're developing new stretch marks. These changes are normal and can be managed with moisturizers or creams. In conclusion, at 19 weeks pregnant, your baby is growing and developing rapidly, and you may be experiencing some common symptoms like back pain, swelling, and skin changes. It's important to continue taking care of yourself by eating a healthy diet, staying active, and getting plenty of rest. Remember to schedule your next prenatal appointment with your healthcare provider and ask any questions or concerns you may have. Thank you for watching, and we'll see you in the next video. Hello and welcome to this video on 20 weeks of pregnancy symptoms and baby development. At 20 weeks, you're halfway through your pregnancy and your baby has reached an exciting milestone. So, let's dive into what to expect during this stage. Firstly, let's talk about the baby's development. At this stage, your baby is about the size of a banana, weighing around 10 ounces and measuring around 6.5 inches in length. They are now fully formed and all their major organs are in place. Your baby's skin is still thin and translucent, but they are beginning to develop a layer of fat to help regulate their body temperature. One of the most exciting developments during this stage is that you can now feel your baby's movements. Your baby is becoming more active and you might feel them kicking or moving around. As your baby grows, their movements will become more defined and frequent. Now, let's move on to the symptoms you might experience at 20 weeks of pregnancy. Firstly, many women experience increased appetite during this stage. 2. You may feel like you're constantly hungry and need to eat more often. This is because your body needs more energy to support your growing baby. Another symptom you may experience is heartburn or indigestion. As your uterus expands, it puts pressure on your stomach, which can cause acid reflux. To reduce this, try eating smaller, more frequent meals and avoid spicy or acidic foods. You may also experience some mild swelling in your feet and ankles. This is because your body is retaining more water during pregnancy. To reduce swelling, try resting with your feet elevated and avoid standing or sitting for long periods of time. One of the most common symptoms of pregnancy at 20 weeks is back pain. As your uterus grows, it puts pressure on your back and can cause discomfort. To reduce back pain, try using a pregnancy pillow to support your body while sleeping and avoid lifting heavy objects. Finally, you may experience some mood swings or heightened emotions during this stage. This is normal as your body is going through many changes, and it's important to take care of your emotional well-being as well as your physical health. In terms of prenatal care, it's important to attend all your scheduled appointments with your healthcare provider. At 20 weeks, you will have an ultrasound to check on your baby's growth and development. This is also when you may find out the sex of your baby if you choose to. In summary, at 20 weeks of pregnancy, your baby is fully formed and developing rapidly. You may experience symptoms such as increased appetite, heartburn, swelling, back pain, and mood swings. It's important to attend all your prenatal appointments and take care of your physical and emotional well-being. Thank you for watching this video on 20 weeks of pregnancy symptoms and baby development. We hope you found it informative and helpful. If you have any questions or concerns, please consult with your healthcare provider.
Balancing Act. A guide for pregnant working women. Managing work while being pregnant can be a challenging but manageable experience. Here are some tips for pregnant women who are also working. 1. Communication with your employer. Inform your employer about your pregnancy in a timely manner. This allows them to make any necessary adjustments and accommodations. Discuss your plans for maternity leave and ensure you understand your company's policies regarding pregnancy and parental leave. 2. Schedule regular prenatal checkups. Attend all necessary prenatal appointments to ensure the health of both you and your baby. Communicate with your employer about these appointments in advance and discuss any necessary time off. 3. Flexible work arrangements. If possible, explore flexible work options such as telecommuting or adjusting your work hours to accommodate your changing needs and energy levels. 4. Take breaks and rest. Listen to your body and take breaks when needed. Short breaks can help alleviate fatigue and stress. Ensure you have a comfortable chair and workspace to support your changing body. 5. Stay organized. Use tools like calendars, planners, or apps to stay organized and manage your workload efficiently. Prioritize tasks and focus on what's most important to reduce stress. 6. Delegate tasks. If you have the opportunity, delegate tasks that can be handled by others. This can help lighten your workload and reduce stress. 7. Stay hydrated and eat well. Proper nutrition is crucial during pregnancy. Stay hydrated and eat balanced, healthy meals to maintain your energy levels. 8. Seek support from colleagues. Let your colleagues know about your pregnancy, especially if it may affect your work in any way. They can provide support and understanding. 9. Create a comfortable workspace. Make your workspace more comfortable by adding cushions or ergonomic accessories as needed. 10. Know your rights. Familiarize yourself with your rights as a pregnant employee. Understanding your legal protections can help ensure fair treatment in the workplace. 11. Plan for maternity leave. Work with your employer to plan for your maternity leave. Make sure you understand how your role will be covered during your absence. Remember, it's essential to prioritize your health and the health of your baby during this time. Don't hesitate to communicate openly with your employer, seek support from your colleagues, and make adjustments as needed to manage the demands of both work and pregnancy.
Welcome to Healthcare Lover. Today, we're going to discuss the top 10 foods to eat and avoid during pregnancy to ensure a healthy journey for both you and your baby. Point 1. Folate-rich foods. First on our list is folate-rich foods. These include leafy greens, lentils, and citrus fruits. Folate is essential for neural tube development in the baby. Point 2. Lean protein. Lean protein sources like chicken, fish, and tofu are crucial for baby's growth and maternal health. Avoid undercooked or raw seafood. Point 3. Calcium-rich dairy. Next up, calcium-rich dairy products such as milk, yogurt, and cheese support the baby's bone development. Opt for pasteurized options. Point 4. Iron-packed foods. Iron is vital during pregnancy. Include foods like lean red meat, beans, and fortified cereals to prevent anemia. Point 5. Fiber-packed fruits and vegetables. Fiber is your friend during pregnancy. Fruits, veggies, and whole grains help with digestion and reduce constipation. Point 6. Healthy avocados, nuts, and olive oil are essential for baby's brain development. They also help with your skin and hair. Point 7. Hydration. Staying hydrated is crucial. Drink plenty of water and consider herbal teas, but limit caffeine intake. Point 8. Foods to avoid. Raw seafood and unpasteurized products. Now, let us discuss foods to avoid. First, steer clear of raw seafood and unpasteurized dairy products to prevent foodborne illnesses. Point 9. High mercury fish. High mercury fish like shark and swordfish should be avoided as they can harm the baby's nervous system. Point 10. Processed and high sugar foods. Lastly, minimize processed and high sugar foods. They can lead to excessive weight gain and gestational diabetes. Conclusion. To sum it up, a balanced diet during pregnancy is crucial for a healthy mom and baby. Remember to consult your healthcare provider for personalized advice. Call TO Action. If you found this information helpful, don't forget to like, share, and subscribe to our channel for more pregnancy tips and advice. OUTRO, thanks for watching, and we wish you a safe and healthy pregnancy journey.
Title: How to Check a Pregnancy Test, a Comprehensive Guide. 1. Introduction. Welcome to our guide on how to check a pregnancy test accurately. 2. Importance of timing. Timing is crucial for accurate results. Discuss when to take the test for the best outcome. 3. Understanding pregnancy tests. Explain the types of pregnancy tests available, urine tests, and blood tests. 4. Choosing the right test. Guide viewers on selecting a reliable pregnancy test kit. 5. Reading the instructions. Emphasize the importance of thoroughly reading the instructions before starting the test. 6. Gathering supplies. List the necessary items needed for taking the test. 7. Collecting urine sample. Offer tips on how to collect a urine sample properly for the test. 8. Performing the test. Step-by-step demonstration on how to perform the test accurately. 9. Waiting period. Explain the waiting period before checking the results and why it's essential. 10. Interpreting results. Provide guidance on interpreting the results correctly, including what different symbols or lines mean. 11. False positives and negatives. Address factors that could lead to false positive or negative results. 12. Next steps. Discuss what to do after getting the results, whether positive or negative. 13. Seeking medical advice. Highlight the importance of consulting a healthcare professional for confirmation and further guidance. 14. Emotional support. Offer reassurance and support for viewers, acknowledging the emotional impact of pregnancy test results. 15. FAQs. Answer common questions about pregnancy tests, addressing concerns and misconceptions. 16. Tips for accuracy. Provide additional tips to ensure accurate results, such as testing in the morning and avoiding certain medications. 17. Handling results. Discuss how to cope with different outcomes and offer resources for support. 18. Partner involvement. Encourage involving partners in the testing process and decision-making. 19. Test disposal. Guide viewers on proper disposal of used pregnancy tests. 20. Conclusion. Summarize key points, reiterate the importance of accuracy, and offer encouragement to viewers. Pregnancy, childbirth, and all the associated experiences are, in my personal opinion, the most extraordinary processes in human biology. However, it's essential to recognize that it's not all sunshine and rainbows. Despite the beauty of children, the journey of bringing them into the world can entail some uncomfortable consequences. In today's video, we'll delve into the changes that occur in a mother's body during pregnancy, exploring phenomena such as morning sickness, fatigue, changes in taste, and the impacts on internal organs as the uterus expands to accommodate the growing fetus. Let's dive into this fascinating topic. Intro. While I may not have experienced pregnancy firsthand, I've had the privilege of witnessing this incredible process twice in my life. The sheer marvel of it is beyond words. My aim with this video is not to dwell on the negatives, but to shed light on some commonly experienced symptoms of pregnancy. In future videos, we'll explore the many beautiful aspects of pregnancy. First on the list is morning sickness. Contrary to its name, it can occur at any time of day and isn't obliged to vanish post-lunch. Although the precise cause remains elusive, the hormone HCG likely plays a significant role. HCG, or human chorionic gonadotropin, doubles every 48 to 72 hours during the first 12 weeks of pregnancy, peaking and then declining. Higher levels may indicate multiple pregnancies or issues like Down syndrome. While most experience relief by weeks 12 to 16, some endure severe morning sickness throughout, known as hyperemesis gravidarum, which poses serious challenges. Moving on to fatigue, progesterone, and its metabolite, allopregnanolone, are key players. Progesterone levels rise steadily throughout pregnancy, contributing to drowsiness due to enhanced responsiveness to the neurotransmitter GABA. Fatigue tends to ebb in the second trimester before resurfacing in the third, influenced by various hormonal changes and the physical and emotional toll of pregnancy. Another common phenomenon is changes in taste, often characterized by a metallic or bitter flavor. While the mechanism isn't fully understood, estrogen likely plays a significant role. Pregnant individuals, particularly females with elevated estradiol levels, report alterations in taste perception, affecting food preferences and aversions. Lastly, the third trimester brings physical discomfort as the expanding uterus displaces surrounding organs. The greater omentum, intestines, stomach, liver, gallbladder, and even the heart and lungs undergo significant shifts to accommodate the growing fetus. While these changes are awe-inspiring, they undoubtedly contribute to discomfort. There are numerous other transformations in a mother's body during pregnancy, including alterations in liver metabolism, kidney function, and digestive system, peristalsis. Feel free to suggest topics for future videos in the comments below. Thanks for tuning in, and I'll catch you in the next video.
Pregnancy week 1 to 2. 1 and 2 weeks pregnant. Congratulations! During the first and second week of pregnancy, your body is preparing for possible conception. How is pregnancy calculated? Calculating the day your baby begins to develop and keeping track of your pregnancy dates can be a challenge. The development of pregnancy is counted from the first day of the woman's last normal menstrual period, LMP, even though the development of the fetus does not begin until conception, which is about 2 weeks later. Pregnancy is calculated from this day because each time a woman has a period, her body is preparing for pregnancy. Counting from the LMP, most women are pregnant an average of 280 days. Calculating from the LMP also gives a standard of measurement for healthcare providers to follow, since it is extremely difficult to know exactly when conception occurred. For more information on how pregnancy is measured, please see our information on calculating your dates.
What changes are occurring with your body? Your period has just begun, and you may be thinking about becoming pregnant. Your ovulation time is the most important thing you need to understand when trying to conceive. Ovulation occurs when a mature egg is released from the ovary, pushed down the fallopian tube, and available to be fertilized. The lining of the uterus. If conception does not occur, the uterine lining will be shed. The shedding of an unfertilized egg and the uterine wall occurs during menstruation. There are also several facts that you need to know concerning ovulation. An egg lives 12 to 24 hours after leaving the ovary. Normally, only one egg is released each time you ovulate. Ovulation can be affected by stress, illness, travel, and significant changes in weight, exercise, and sleeping patterns. Some women may experience light spotting during ovulation. This is not considered to be an actual period, but rather an ovulatory bleeding. What is happening with your baby? Nothing is happening yet, but be patient while the stage is being set. Before long, an egg will be released and will be available to be fertilized. How do you track ovulation? A woman's monthly cycle is measured from the first day of her menstrual period until the first day of her next period. On average, a woman's cycle normally is between 28 to 32 days. Ovulation is calculated by starting with the first day of the cycle, which is the day the menstrual period begins. Most women ovulate on any one day between day 11, day 21 of their cycle. This is what many refer to as the fertile time or fertility window of a woman's cycle because sexual intercourse during this time increases the chance of pregnancy. For more information on tracking ovulation, please see Fertility Awareness, Understanding Ovulation, Ovulation Calendar. What should you plan at this time? There may need to be some lifestyle changes made at this time to increase your chances of conceiving and having a healthy baby down the road. Adequate exercise and a balanced diet are important factors to evaluate. It is recommended to begin taking prenatal vitamins and stop using substances such as caffeine, artificial sweeteners, alcohol, recreational drugs, nicotine. If you are taking prescription drugs, check with your healthcare provider to see if such medication is safe to take during pregnancy. For more information on nutrition during pregnancy, please see our information on preconception nutrition. Tips for making your pregnancy better. The most important thing you can do right now is to act in the way you would if you already knew you were pregnant. Since it can be weeks before you know if conception has occurred, this will protect both you and your future baby from any substances or activities that could cause problems.
3 weeks pregnant. Sperm met egg last week, and voila, you've made a baby. It's so early that when you're 3 weeks pregnant, you may have no idea that you're actually pregnant. Conception just happened a few days ago, and there probably hasn't been time for you to miss a period yet at week 3 of pregnancy. Can you tell you're pregnant at 3 weeks? While some people feel no difference at all at this early stage, others may start to notice 3 weeks pregnant symptoms. The experience at 3 weeks pregnant can really vary, so don't fret if you don't feel anything out of the ordinary. However, if you feel nauseous and your breasts are sore, that's normal too. Everything changes quickly in early pregnancy, so no matter how you feel, be prepared to feel different in a week. 3 weeks, pregnant symptoms. When you're 3 weeks pregnant, symptoms may not have appeared yet. That's because most early pregnancy symptoms are caused by pregnancy hormones. Spotting as the fertilized egg burrows into the lining of your uterus. Nausea. As the pregnancy hormone HCG begins to make its way through your newly pregnant body, you may notice some feelings of queasiness, or nausea so bad it makes you puke. Morning sickness should really be called all-day sickness since it doesn't discriminate by time of day. If you're feeling this symptom of pregnancy at 3 weeks, you may be further along than you thought, or you may even be 3 weeks pregnant with twins. That's because twin moms-to-be often have higher levels of pregnancy hormones and therefore worse nausea. Breast changes. Your breasts can start to get sore, and your nipples may darken as your body starts prepping to make milk. Missed period. If your cycle is typically shorter than 28 days, you may realize toward the end of this week that you could be pregnant. The only way to know for sure is to take a pregnancy test. Positive home pregnancy test. Check the box of your home pregnancy test to see how accurate its results are before your missed period. Most are over 99% accurate once you've missed it, and some brands promise to detect pregnancy hormones in your urine sooner than that. For example, when you're 3 weeks 5 days pregnant or even 3 weeks 4 days pregnant. Here's the thing, the amount of pregnancy hormone HCG in your body might not be enough for the test to detect right away, but it doubles every 48 hours. If you get a negative result, follow up a few days and then a week later with another pregnancy test and then another, to be sure it wasn't just too early to tell. Positive blood pregnancy test. In some cases, like if you're at risk for miscarriage or ectopic pregnancy, your doctor may ask you to come into the office for a blood draw. Blood tests can detect smaller amounts of HCG than urine tests can, so you may find out that you're pregnant. 3 weeks, pregnant belly. A belly isn't really a thing. Though you may feel a bit bloated, most pregnant women don't start to show until around week 12 or later. Before you start eating for 2, know that doctors only recommend most women gain 1 to 5 pounds total in the first trimester, that's the first 13 weeks. So you definitely don't have license to start indulging at 3 weeks pregnant. In fact, try to eat a healthy, well-rounded diet and to take a daily prenatal vitamin with at least 400 micrograms of folic acid in it. Doctors don't recommend increasing your daily calorie intake until the second trimester. Once you hit week 14, you'll want to add about 300 calories per day.
During week 4, the tiny life you and your partner created just a week ago is implanting and settling into its new home in your uterus, where it will grow and develop over the next 36 weeks. Along with implantation, comes a rise in the pregnancy hormone HCG. At the end of this week, there may be enough HCG to detect with a sensitive early home pregnancy test. First, what is your baby's due date? Your baby's development at 4 weeks. Starting at week 4, your baby is called an embryo. At just 0.0 meters, your little embryo is about the size of a poppy seed. Implantation. When the fertilized egg is in the uterus and attaches to the uterine wall, it is called implantation. Implantation usually takes place 6 to 10 days after ovulation. So, if it didn't happen at the end of week 3, your budding baby will burrow into your uterine lining this week. Early development. There inside your fertilized egg are all the cells that will develop into your baby and what your baby needs to survive for the next 9 months. The inner cells begin to transform into your baby's organs and body parts. The outer cells start to form. A few weeks later, the placenta will be fully formed and take over the transfer of nutrients to the embryo. The embryo is surrounded by fluid inside the amniotic sac. It's the outer layer of this sac that develops into the placenta. Cells from the placenta grow deep into the wall of the womb, establishing a rich blood supply. This ensures the baby receives all the oxygen and nutrients it needs. You at 4 weeks. Conception usually takes place about 2 weeks after your last period, around the time you release an egg, ovulate. In the first 4 weeks of pregnancy, you probably will not notice any symptoms. The first thing you may notice is that your period does not arrive, or you may have other signs and symptoms of pregnancy. You can confirm the pregnancy with a pregnancy test.
5 weeks pregnant symptoms. Pregnancy symptoms are unique and unpredictable. 2 people can each have healthy pregnancies without any of the same symptoms. Likewise, you may have bad nausea in your first pregnancy, but no morning sickness in a later pregnancy. The swiftly rising levels of the hormones human chorionic gonadotropin, HCG, and progesterone are responsible for many of the pregnancy symptoms you experience. You can expect any of the following week 5 pregnancy symptoms. 1. Morning sickness. Don't be fooled by the word morning. Nausea and vomiting can happen at any time during the day. While morning sickness typically begins during week 6 of pregnancy, some people experience it earlier. Eating several small meals throughout the day, instead of 2 or 3 big meals, may help to relieve these symptoms. Call your doctor if you can't keep any food or liquid down. This may be a sign of hyperemesis gravidarum, which is a rare disorder that involves continual nausea and vomiting during pregnancy. It sometimes requires inpatient treatment at a hospital. 2. Lightheadedness. Your blood pressure tends to run lower than usual during pregnancy. This can cause dizziness and even fainting. If you feel dizzy, sit down if you're standing or pull over if you're driving. 3. Frequent urination. As your uterus expands, it can press against your bladder. This will likely cause you to need to urinate more frequently. Go when you have the urge so that you avoid bladder infections. Drink plenty of water to avoid becoming dehydrated. 4. Abdominal cramps. You may experience mild cramping or bloating. This can be caused by the egg implanting or from your uterus stretching. While mild cramping shouldn't cause alarm, contact your doctor immediately if you experience severe pain that doesn't go away. 5. Vaginal bleeding. Light bleeding, also known as spotting, around the time of your missed period is usually considered implantation bleeding. While spotting can be caused by many factors, always let your doctor know if you notice any spotting or bleeding at any time during pregnancy. 6. Fatigue. As your progesterone levels increase, you may find yourself feeling sleepy and losing energy. Fatigue is most common during the first trimester, but some people will experience fatigue throughout their pregnancy. 7. Breast changes. You may experience tender, sore, swollen, or fuller breasts as your hormone levels change. This is one of the earliest symptoms of pregnancy and may appear soon after conception. 8. Food cravings and aversions. Your changing hormones can lead to a change in your appetite. You may find yourself avoiding foods you used to enjoy, or you may start craving foods you don't commonly eat. You can begin experiencing food cravings and aversions early on in your pregnancy. 9. Constipation. Your food will start moving more slowly through your digestive system to give nutrients more time to be absorbed into your bloodstream and reach your baby. This delayed transit can lead to constipation. Eating more fiber and drinking lots of fluids can help relieve or eliminate constipation. 10. Increased vaginal discharge. Vaginal discharge during pregnancy may be expected. It should be thin, white, milky, and mild smelling. If the discharge is green or yellowish, has a strong smell, or is accompanied by redness or itching, you should contact your doctor. This is likely a sign of a vaginal infection. 11. Mood swings. Pregnancy can cause a lot of emotions. Not only can the idea of a new baby cause emotional stress, but the changes in your hormones can also affect your emotions. It's perfectly fine to feel a variety of emotions from day to day, such as elation, sadness, anxiety, fear, and exhaustion. If these feelings are extreme or last more than a few days, consult your doctor right away. Warning signs of a miscarriage. According to the American College of Obstetricians and Gynecologists, about 10% of pregnancies end in miscarriage. Signs of a miscarriage include vaginal bleeding, the most common sign, which tends to be heavier than spotting and may contain clots. Abdominal or pelvic cramps. Back pain. Call your doctor if you experience any bleeding during pregnancy. An ectopic or a tubal pregnancy is a pregnancy that grows outside the uterus, most often in the fallopian tube. This type of pregnancy isn't viable and can be life-threatening to the birthing parent. Symptoms of an ectopic pregnancy include vaginal bleeding, pelvic pain or cramping, possibly on one side, shoulder pain, dizziness or fainting. Call your doctor right away if you feel as though you are having symptoms of an ectopic pregnancy. Your baby development. The 5th week of pregnancy marks the start of the embryonic period. This is when baby's body systems and structures begin to form, such as the heart, brain, and spinal cord. Your baby's heart beats at a steady rate now, though it may not be detected by ultrasound for another 1 or 2 weeks. The placenta is also starting to develop. At this stage, your baby doesn't look like a baby yet. The embryo is growing quickly, but it's still very small, about the size of a pen tip or a sesame seed. Around this time, baby initially measures just 2 to 3 millimeters. Your body is gearing up to go through big changes, too. Pregnancy hormone levels are rapidly rising, and your uterus will begin to grow. You won't look pregnant for a couple more months, but you may start to experience symptoms now. Twin development at week 5. If you're carrying multiples, you may be able to detect your babies through an early ultrasound during week 5. Your babies are measured in millimeters at this point, but you might see 2 gestational sacs or even a couple of tiny fetal poles as the week goes on. Occasionally, you'll detect 2 gestational sacs at this early stage, but only 1 baby. This is called vanishing twin syndrome. There's often no clear reason for the loss, per 2021 research. You may have cramping and bleeding, or you may have no symptoms at all.
6 weeks pregnant, your little one is developing new features. This week's most important milestone, the neural tube begins to close over what will become your baby's spinal cord. There's more. This week, the areas that will become the eyes and ears have started to project as bumps, and other tiny buds are forming that will eventually grow into arms and legs. A tiny heartbeat of about 105 beats per minute may be detectable in an ultrasound this week, and the brain and nervous system are also developing quickly. In fact, the nose, mouth, and inner and outer ears are just starting to take shape, along with the lungs. In just a few weeks, breathing tubes will form between the throat and the lungs, getting ready for your little one's first breath of air, and maybe a loud wail, at birth. The size of the embryo at 6 weeks pregs. Your embryo measures an average of 0.08 to 0.2 inches, about the size of a pomegranate seed. Take a look at the visual below to get an idea of how things are progressing inside your belly. At 6 weeks, when it comes to the embryo, things are starting to take shape. Mom's body at 6 weeks pregnant.